Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many, produced by the Commission on Aging, of which I am a community member. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie Smith. Now, on this month's show, we're going to talk about fitness and hearing. Joining me is Denise Mornini. Hi, Denise.
Hello.
How are you?
I'm very well. Just had an exercise class about an hour ago, so I feel great.
That's awesome. Well, everyone, Denise is retired from the city of Gaithersburg, and as you already know, she just mentioned she's a fitness instructor. But can you tell us a little bit more about your background?
Sure. I had a 20-year career with the city of Gaithersburg in recreation. Half of the career was at the Benjamin Gaither Center, which was then called the Senior Center. Um, and I was the program supervisor, so did all kinds of things with seniors, including teach classes. Um, and then I moved to working in the recreation classes for general population. So organized classes in all the different community centers that Gaithersburg has. And they were for all ages, but I, again, still kept teaching. Um, Predating my career in the city of Gaithersburg, I was an instructor. I worked for Nancy Briette, who is with Wet Yet. She's the owner of Wet Yet Water Fitness and various other fitness classes that she offers. And I taught. I was trained by her, but I've been certified through through AFA, which is the Aerobics and Fitness Association of America. That's in group exercise, and then I'm also trained in aquatic exercise through AEA. I currently teach a number of classes, but in my career I've taught aerobics, step, water aerobics, both shallow and deep. I've taught strength training, chair fitness, stretch. And right now I'm currently teaching fitness at Asbury Methodist Village. I teach water aerobics there, and I teach at the Benjamin Gaither Center, a core and stretch class. And I teach at the Activity Center at Boer Park. I teach a HIIT class. So I try and still walk the walk.
It sounds like you stay very busy, Denise. And it's my understanding too that some of our commissioners attend your classes. So that's
Yes.
really great. Well, tell us about the four main benefits of exercise that keep older adults healthy.
Okay. Well, I like to think of them all working together, but there are four components that are important. We have endurance, which will help with heart and lungs and circulation. And they also have a little extra benefit of producing endorphins, which are emotional and it's like a self created antidepressant. Strength training, which is any kind of resistance. So you can have dumbbells, you can have bands, you can have uh, floaties in the water, various things that resist your muscles to create some tension. And that's benefits would be bone density, toning your muscles, stabilizing your joints, helping to reduce body fat. But I don't like to emphasize that. Honestly, I think I think that accepting our bodies at this age in our lives and working with them to keep them healthy is really important. Um, Balance, which is that is very important, and it's more so as I get older, and I know my participants get in need of it because a balance helps with all the coordination that you have. It helps fall prevention, obviously. It reduces your reaction time, which is important in driving, important in a lot of things. And it also improves your posture. And if your posture's balance exercise helps your posture, which helps you feel better. Standing up tall, feeling in line is real important. And then flexibility, which increases it, decreases the likelihood of injury and allows you to get a full range of motion in your joints, and it increases your blood flow. So,
Wow. So I think you said strength, balance, flexibility, and
endurance.
endurance. Wow.
Yes.
Thanks for sharing that. Well, what about the best types of exercise routine for older adults? Can you tell us that? And are there practices that may be better than others that fit within that balance, strength, endurance, flexibility?
Well, it's really hard to generalize. And I don't like to generalize because what may be the best for one person is not the best for another. Generally, low impact is safest, and so whatever the activity, low impact is safer. But impact does help build bones. So, and it's also been proven that long distance runners sometimes have less arthritis than people who do. It's individualized. I will say the best kind of exercise is the kind that you want to do. So I think it's really important. The mindset for your exercise is that I want to do it. And I can speak for myself that having done it for 30 years, having retired, I could be sitting down, I could just be floating along. And I really need and love my exercise. It has become something big, a big part of my life. And most of the people who join classes do knit in the importance of it into their lives.
So, not generalizing, but it is important that we do move. Can you tell us how much physical activity do older adults need?
Well, I think there's a general rule of thumb that has been, I looked up for that question, and 150 minutes a week is basically what they recommend for adults. 150 minutes of exercise, meaning you're moving, and you might involve some cardio in that, some deeper breathing. There's also the need for some of that to be strength training, where you're challenging your muscles. That can be broken up in any different way. So you could take 10-minute breaks through the whole week, or you could take 5 30-minute classes, or 5 30-minute runs, or swims, or whatever. You can break that up however you want. It's the importance is that you just do it regularly.
Regularly, the consistency, and our target is 150 hours per week. Okay.
Minutes.
Sorry. 150
We
minutes.
lose a few people.
Okay. So, what's a good way to get started for beginners? Not everyone has maintained an active lifestyle. Some people start, they stop, but if you want to get started again, what's a good way? And what are some, things that people should try if they have varying abilities? They might not be, as strong, especially as it relates to this strength training. So, share with us.
Right. I'm a great proponent of senior centers, because obviously I worked at one, but I started at my senior center that I worked at in my 40s, and I realized really quickly it was the best place. It was like Vegas. It was so cool. There was so much going on, so many different things offered, very affordable, and very, very non-intimidating. So classes are being offered in senior centers all over the county. I wrote a list of the senior centers, and there's just so many. I won't go through it. There's so many senior centers, but you can also. It's important that you find what works for you. So especially someone with limitations. A personal trainer might be a way. A lot of people come into exercise late in life if they haven't exercised because they've had a wake-up call. Their doctor's saying your diabetes is out of control. You're going to have a stroke. There are various reasons. Your doctors are going, time to get moving. And those people, I really think it helps to have a really safe sense of like, I belong here. No one's going to look at me funny. They won't hurt me. So I really love senior centers or classes that are designed specifically for older adults. And I know that when we talk about fitness levels in the older years, it's so wide. Some people are, they're starting, like probably the ones who are running, and jumping and doing 10 pickleball day classes a week or what those games a week. Those people have had a lifetime of it. Beginners need some hand holding. And
Yeah.
I love that. I love having people come into my class for the first time. It's a pleasure because I almost always, I can't think of any time when I haven't seen improvement. Improvement, for those of you who have just like want to maintain, that's good. But to get started, let someone hold your hand. Let someone welcome you in.
I really like that approach. I have a few more questions for you, but I know that I'm getting short on time. So I'm just going to ask away and see where we land. Can you talk a little bit about maybe the other components of exercise as it relates to our overall wellness? I know there are benefits to exercise beyond just our physical bodies. Can you talk about that?
Well, yes. Socially, it's exercise. Now, I know there are some people, I have dear friends who just want to get on their own personal bike at home and their treadmill, and they don't want it. That's not where they don't want to get their social interaction that way. Great for them. But many people sit at home alone, and there's a pandemic of loneliness in this country. We were stuck inside by the pandemic, and it's motivation to get out, overcoming the fear. All of that really can be just dissolved by joining a class. You are in a situation where you're among other people. You'll learn their names. You're all joining in. It's a social. It becomes a little community, and it really addresses social need. And I think another benefit is that the benefit of having mental health component is that a lot of doctors and psychiatrists will recommend to patients that in addition to medication, exercise helps build self-esteem, helps with depression, with anxiety. It's a stress releaser. So those are benefits.
Was there anything else that you would like to share with us that perhaps we didn't cover? I do want to be clear, it's 150 minutes, but is there anything
It's
else
doable.
that you want to share?
It's doable, the 150 minutes, but you don't have to start there. You can start with 50. Start. I will say I'm a big believer in treating yourself to this is something you deserve. You've made it to this point in your life, and buy yourself some good sneakers. Let yourself spend on yourself once in a while. Join a class or get that extra. It's self-care, and it's not a drudgery. If you get all the benefits, you'll be thankful.
Denise, we want others to be able to benefit from, taking your classes and being welcomed if they're beginners. How can we stay in contact with you?
Well, I can be reached at info at Wet Yet Water Fitness, and then the Benjamin Gaither Center. I don't have their phone number written down. I'm sorry, but it can be Googled, the Benjamin Gaither Center. So.
All right. Well, thank you so much for taking the time to speak with me today. I've certainly learned a lot, particularly about the four major benefits of fitness and then the other areas of our lives that it impacts. So we hope that we can have you back again soon. And again, just thanks for sharing with us.
Thank you for having me. It's nice to be here.
Up next is Dr. Carrie Neiman. Carrie is an associate professor in the Department of Otolaryngology at the Johns Hopkins University School of Medicine. Welcome back to 50 Plus in Montgomery County. Joining me is Dr. Carrie Neiman. Carrie is an associate professor in the Department of Otolaryngology at the Johns Hopkins University School of Medicine. Hi, Carrie.
Hi, Katie. How are you?
I'm doing well. What about yourself?
Great. Great.
Carrie, tell us about your background and what you do.
Thanks. Yeah, so I'm an otologist, which means I'm an ear surgeon. I practice at Hopkins, and I see patients for things all related to the ear and hearing. But then I also spend a good portion of my time as a researcher and scientist thinking about more affordable, accessible hearing care for older adults.
Hmm. Now, what are some of the universal causes of hearing changes in older adults? Like, tell us what the research says about what we need to know.
Great question. So, first of all, hearing loss, as we really all know, is super common. Almost all of us at some point in time are going to experience some change in hearing. And so we can think about things certainly like noise exposure, whether that's through work or hobbies, can certainly play a role. And we definitely want to support kind of ongoing use of hearing protection. But by far and away, the biggest driver of hearing loss are age-related changes that, like I said, almost all of us will experience at some point in time. There can be some exposure to medications, things like certain chemotherapy agents, for example, that can also influence our hearing. But at a population level, age is really the biggest risk factor.
Mhm. So, with age being their biggest risk factor, how common is it? And, like, what are the first signs of symptoms?
Yeah. So when we look at nationally representative data kind of across the United States, and if we looked at everybody who's 70 years or older, we see that around 2/3 of individuals have a clinically significant hearing loss. And if we look at everybody who, for example, is 80 years or older, over 80% have a clinically significant hearing loss. So when we talk about it being common, right, it's really common. So a lot of hearing loss, there's a spectrum of it, right, in terms of severity. And a lot of it really, again, at that population level is in the mild to moderate range. And so when we're talking about mild to moderate hearing loss, particularly age-related changes, some of the things that we know, and I think all of us can identify with, for ourselves or friends or family members, is that age-related hearing loss is really gradual. So it can be really tough for us to kind of be aware of some of these changes that are happening. So in that mild to moderate range of hearing loss that's happening slowly, oftentimes people will notice, man, a lot of people just really mumble. It's not, so much me, it's you are speaking softly or you are mumbling. And oftentimes that sensation of, I can hear you, but I can't really understand you that well. And some of the earliest signs of it is when we really start to struggle when there's some background noise. So if we're like at a family gathering or a restaurant, something like that, and there's a little bit of background noise and we're like really kind of struggling to listen in and understand, those are a lot of the ways in which we can start to tune in and be like, maybe it isn't the other person. It may be, in fact, that I'm experiencing some changes.
Hmm. Now, you mentioned therapeutics for cancer, one therapeutic such as chemotherapy. Is hearing loss related to like any other chronic diseases or
Yeah,
um,
good question. So there has been a lot of work to understand if some common things like diabetes or
Mhm,
cardiovascular disease, in terms of
mhm,
kind of heart health related things, if there are associations in terms of if those are risk factors for hearing loss. And the results at a population level are fairly mixed. So we think that generally, as healthy a lifestyle as possible can hopefully help preserve hearing health for as long as possible. But we don't have really great concrete data at a population level to be able to say, yep, diabetes is a risk factor for hearing loss. We can't go that far. A lot of the work has focused on, well, does having hearing loss put you at risk for other things? And so that
mhm,
is a little bit of area where we have a little bit more information about as well.
mhm. Are there different types of hearing loss?
Yeah, so the most common form of hearing loss is what's called a sensorineural hearing loss or a nerve-related hearing loss. And so that's really the most common form. That's what we think of in terms of age-related changes or from noise-related exposure, things like that. There can be a small percentage of individuals at a population level can have some other types of hearing loss, which are considered a conductive form of hearing loss. So that could be due to having fluid behind the eardrum or the eardrum having a hole in it, things that may be causing kind of the sound waves or the signals to not enter and be transferred into the inner ear as well as they should be. But that represents a pretty small number of individuals, again, at that population level. So vast majority of hearing loss that we're talking about is kind of this nerve related hearing loss that we can see with age related changes.
Hmm. Now, you've shared with us, how common it is, some of the first signs, what the research says, and the different types of hearing loss. What are some of the negative impacts of hearing problems?
Yeah. So I think a lot of us have for a long time thought about, yeah, hearing loss is really common,
Mm,
and that it's just this benign part of the aging process that, yeah, it's kind of frustrating, but, there really isn't anything to do beyond that, that it really doesn't have kind of other consequences. That kind of thinking has really changed and shift in the past, decade, 15 years or so, because a lot of the work that has been coming out of understanding that, yeah, hearing loss, age-related changes in terms of hearing, has been independently associated with negative outcomes in almost every aspect of aging. So there have been things like looking at hearing loss as a risk factor for things like falls, for hospitalization, for loneliness, depression. And I think the biggest one that has, some people may have heard about is the association between hearing loss and age-related hearing loss, and then things like memory changes. So things like dementia or accelerated cognitive decline. So that's an area where we have had a lot of work and study, including a lot of the work that's been done at Hopkins and many other places around the country and internationally. And we've, learned a lot in terms of the fact that, pretty consistently hearing loss, even a mild amount of hearing loss, has been associated with things like a 2 times increased risk
mm,
of dementia or cognitive changes. And all of these numbers, you have to remember, are at a population level. So definitely not something that we can say, like, if you have hearing loss, that puts you at a 2 times increase. That's definitely not what we're saying. These are things that we see at a population level. Um, and so, yeah, that's kind of where we're at now in terms of thinking about, does hearing loss matter? And we think, yeah, we do think that hearing loss matters, and is a reason why we need to start thinking about, really everybody to be thinking about, we should be taking action, even if we have a mild amount of hearing loss.
mm. So we're all aging, we're all getting older. How can we improve hearing loss as we age?
Yeah. So great question. At a baseline, all of us should be thinking about hearing protection and using hearing protection regularly. That can certainly get us to some degree. But as I mentioned, a lot of these changes are going to happen to some degree, kind of in some ways, regardless of what we do, because of just who we are in terms of our genetics, our family history, kind of our lifetime noise exposure, and again, age. So with that in mind, things that we can do, if we do start to experience some changes is, I think one is to be open to the fact that you may be experiencing some hearing changes and that it's really common, and that there are options of things to do about it. So we kind of view addressing hearing loss in two different ways. We have things like what are called communication strategies. So like really kind of simple things that we all likely do, already. Things like making sure we get face-to-face, that we turn down background noise, that we kind of close the distance, in terms of like not necessarily like screaming from across the house, get the person's attention first. Those are, a solid foundation of things that can help everybody when they have a little bit of changes in their hearing. And then we partner that with things like amplification. So oftentimes we're talking about things like hearing aids.
I only have 2 minutes left with you. I have a couple more questions. Here at the commission, we do prioritize public health issues. So from a public health perspective, I want to know this little fine point. Does every patient need to see a doctor if they're experiencing hearing loss?
So great question. Some people may be aware, just in the past couple years, we now have over-the-counter hearing aids, which is a really exciting advancement in terms of trying to get more people access and help related to their hearing. So over-the-counter hearing aids are a set of hearing aids devices that are high quality. They've been tested and reviewed by the FDA when we're talking about self-fit over-the-counter hearing aids, and are designed for individuals who perceive that they have a mild to moderate degree of hearing loss. So if you're somebody who is having some changes, but you're not quite maybe ready to see a doctor or an audiologist, but you're like, yeah, maybe I want to try one of these amplification devices or hearing aids, I would strongly encourage people to think about trying out some of these new devices. If you are somebody who, would like some more information and, would like to work with a hearing care professional like an audiologist or an ear, nose, and throat doctor or otolaryngologist, those are great options as well. So the hope is that more people do something about their hearing and that there's more options and paths forward.
Dr. Carrie Neiman, this has been a great conversation. Is there anything else that you would like to share with us?
I think the biggest thing is, to take action, to know you're not alone in terms of having some hearing changes, but there's a lot of great options out there, and that we think it matters. So whether you take action now or in a couple of years from now, but we think by doing something about your hearing health, really thinking about kind of how do you set yourself up to age as well as possible, just like we take care of our eyes and our vision, making sure that we can hear and our brain is getting as clear signals as possible. And that is right along everything else that we're thinking about of how we want to stay engaged and, vital members of our communities. So yeah, thank you.
Thank you so much for joining me today, Carrie.
Awesome. Thanks, Katie. Thanks for having me.
Well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.